Welcome again, everybody. I'll try just to give you a very short outlook of what can be the vCare exploitation path, and I put a possible S because as we have already mentioned it several times, it's a complex project, and we want to give all possible chances to have the results exploited, whatever the channel, the final channel. So, yes, we were so happy to find a project which was actually responding to a gap, a clinical gap. Say, yeah, well, we're not going to have anything disruptive where people have to change everything from start. Wow, we have a solution. So we're not challenging any people on the field. We're proposing something which is not going to disturb people, but we provide, I don't know why it's working alone. Sorry. Okay. But so we had a solution, and we knew from the start, that has been said, that it had to be a cooperative model. It means that everybody had to know, can we do something so that the slides are not moving by themselves? Thank you. Oops. Okay, I let you move it. Okay, so here I just have put a quote here from external people who said that vCare can offer a unique opportunity to engage traditional players, actually, in integrating innovative new technologies with a solution, as I said, which actually for which there is no real solution in place today. Next slide. But as Hannes has already mentioned it at the very beginning, this is not a final product. This is not a proof of concept. This is, you see the point? This is a system that we wanted to reach a certain maturity in order to bring it to a superior level with the idea that we could conduct a large-scale randomized trial, so to collect the necessary clinical evidence. That's the idea. So we need to do that to make our current TRL7 more robust, and we already know it, and I very much thank other projects and ProCare for Life in particular, just to have said that, well, yeah, that's not an easy one. And we also experienced a lot of problems, a lot of technical problems. And it was not easy to keep our patients engaged while dealing with those problems. So we need to improve very seriously the user experience. And I must say, the user are speaking about patients, but I think we also need to think about healthcare professionals. So we need to engage them the right way, at the right moment, providing them with the data exactly what they need. Not more, not less, in the right format and with the right interface. It's quite a challenge. So we need also to be open to other use cases. That's, again, something that Hannes has put forward, which is really true. We designed a solution to support many use cases. Actually, it's pathway basis. So whatever the pathway is, it can be supported. We can add activities. We could think about other interfaces. Other projects have been proposing and testing other interfaces. They could be brought together. There will be adaptations to be done, but of course, that's the idea. So next slide. So how do we compare with other projects? So we have, we have other projects which have sometimes components more developed, but just like us, they don't necessarily have all the components, but some components are better, and we have maybe more components, but nobody is yet on the market, I would say. So everybody is on the same stage. And we have not yet an existing product which propose all the features of vCare. Why? Most of the time we think that The value proposition that we propose, once again, with this addressing a gap, with pathway which are today incomplete or not sufficiently followed by patients, and pathways which are static, so which do not evolve sufficiently quickly with the patients and with the evolution of the patients, and it's not sufficiently holistic. So they're either too clinical, either too social, either too something, but not everything. So that's the problem. While we will see today that there are a number of very interesting solutions, and we have some of them presented later, which are beginning to be very successful. They are simple in a way, but they are getting more complex, stage by stage. But they found their entry on the market, and they are building on that. So they are mainly focusing today on physical rehabilitation functionalities, but of course, their solution might also evolve further. We'll see that further. So physical rehabilitation, let's be clear, that's the vitrine. That's the vitrine for the rehabilitation aspect, I would say, of care today. Next slide, please. The baseline market, as I called it, is for vCare, is that we need to have at least a similar or at least approaching user experience to existing product. That's to enter any market. That's the first thing. The second thing is that the AI, the machine learning component, as we said, is only very preliminary within vCare. It's clear that something which could make a big difference with other products, because it will, and especially because it will strive the dynamic of the pathway, it will support it, and it will clearly give the power to the patient and in handling the activities. And we need that to be very intuitive. We need additional evidence on the pertinence of the activities, their impact, and the capacity of the course to integrate all the data of the home environment. And finally, we need a pricing, and we'll see that's a problem, that's an issue that has been mentioned. Hardware is an important part of the vCare solution, and that's still extremely expensive. And when we compare with other solutions, we see that basically there is no way we can enter the market today with that price, at that price. Although we will see with Rokio that still, if we compare with the current cost, it could still do it, but maybe not enough to convince the people to buy the solution. Next time. So we conducted a SWOT analysis within vCare, and we see that actually we have there are a lot of opportunities because what we have seen in the project is that the clinical partners were extremely motivated because they were actually acknowledging the problem, and we've seen that in countries like in the Basque Country, where there are people living in remote areas without access to services, and so it was already, with all imperfections, already giving a high satisfaction rate to patients, even with all those technical problems. So you see that the need is there, and the solution can really make a difference. So we not get into that any longer, but next slide, please. So what we decided that our minimum viable product should be is that it should provide an adaptive integration, orchestration, and use of coaching services according to a personalized, evidence-based pathway, which are applied to 3 use cases, but which needs to be scalable to other use cases. And that's the key features that we need to have integrated. We decided that we needed all activities which have been listed by Massimo today, but 4 of them were seen as nice to have, or very nice to have, but not absolutely compulsory to have. So next slide, please. We also conducted a first attempt to have a business modeling canvas. And what you see in red is that what is for us pertinent for the next phase. So we not, although we try to project ourselves already into how can we reach all the stakeholders of the market, we will first focus, obviously, on the influencers, so the people and the companies who have already a know-how, an interest, an experience with it. The idea is for us to find more clinical sites who would like to engage in the existing use cases, and possibly a new cooperation with a digital regional hub or another use case in order to test the solution for a longer period, for 2-3 years, and to have the sufficient number of patients and data. Next slide, please. So let's go on. So we know also that now getting a product on the market is not only about finding the right way to get into the market, it's also complying with many things. And well, the implementation of the EU medical device regulation makes things, of course, much more secure for everybody, but also much more complex for the people who develop solutions, because that's costs, actually. And we believe that as vCare, we should be, at the end of the day, considered as a Class 2A solution. So we're not going to put the patient in danger with the solution, but there are still connectivity and security issues which could, at some degree, affect the patient. So we need to conduct a very high and precise risk analysis. As I said, the AI component for the time being is only supposed to have an impact on well-being and quality of life. And hopefully, in a further evolution of vCare, we hope to see how can we use those data to, as I said, support the evolution of the pathway. But the interaction between the healthcare team and the AI, the machine learning component, will then to be discussed in this further progress. Next slide, please. So that's the 4 components which are the most at risk that we need to really scrutinize: the virtual coaching hub, the games component, the vital signs processing, and the AI's modules. That's the ones that we are going for, which we will need to conduct a very detailed risk analysis. Next slide, please. We already identified in the product a number of things that we need to, it's strange, huh? To improve. We need to reduce the system complexity. We need to reduce the installation and training complexity. We need to collect much more patient data. And you already heard it from another project, right? About we have the same conclusions. We need to do that. We need to have much easier user interface. And I think it's Shapes who said, well, you need to have only one button and everything in the background without asking any specific action to the patient to be done on the technical level. It should be completely technologically agnostic. So that's what we need to do in order to have a baseline. And we also see that we need to document a bit more the condition requirements of integration of additional third-party solution application. We already have it, but only in an embryonic way with vCare as a service, but we need to do it more. We spoke about, there was a question this morning about the data portability, and that's another issue. Actually, today the data are part of the system, but from an open perspective, it should not anymore. If we want to be part of a global ecosystem, the data should be under the control of the patient, wherever they are. So that's another point. And we need to consider the improvement of the current professional dashboard, as I said, with the right information at the right moment. Next slide, please. And that's not all. We also need to work not on the technical level, but we need to convince the healthcare professional. And within the vCare projects, we conducted a few workshops with other projects and so on. And actually, what we found out is that there are 2 major dimensions which are still very much immature in organizations, and that's the removal of inhibitors. First of all, because most of the people are not even aware of what those inhibitors are. And thus, there's no strategy to tackle them. And the readiness to change. So there are still, this is changing with the COVID a little bit, but there is still high resistance. Next slide, please. And the other thing, which is also very clear, is that, and that's a slide coming from a very recent McKinsey study, saying that the market actually is now getting ready, but the big problem is the lack of integration of the services. That's what we've been saying. So people and hospitals do not want to buy 15 solutions for every single problem that might occur. They want to have an open platform to, in which they can select the solutions which fit to their purpose. So that's where we need to start if we want to sell more advanced solution today. Next slide. Finally, there are many interesting things also developed by each individual partner. So within vCare, every single partner has tried to design the component that they have developed in such a way that that could be reused by other projects, other companies. And this, as you can see, they reach different level of maturity. But that's something we try to develop to give the results of vCare the maximum of chance to be reused. Next slide, please. So what we have in mind today is now a roadmap, I would say, of 3 years. Well, the amount of €2 million is worth what it's worth. We'll see exactly, it's a first estimate, but that's what we believe is today needed in order to collect the necessary evidence and to work on the improvement of the solution today, the robustness, and to comply with the regulations and do the necessary work. So, this next slide, the way we propose to do it is actually to have only one company. We have only 2 companies, big or rather big companies, if I can say so, in comparison to the others. One in Romania, one in Spain, and so it should be Simavi on the slide. I don't know why I didn't change it. Sorry for that, but not. Yeah, that's it. Sorry. So I forgot to. Yeah, that's the right slide. Thank you. So and we all signed a MOU all together with Simavi as an integrator. So he will guarantee, I would say, that all the different components remain active and be the focus point for possible new pilots will be developed afterward. Next slide, please. So that's the current architecture that we will try to maintain during this period of time. Next slide. And as I said, we also want to support indirect exploitation, and that's why we've been putting all the things that we thought were important from a technical point of view in one single document. We know how hard it is usually when you look for things and you have to look in all those deliverables that the Commission asked us to write. So we said, no, we're not going to do that. Of course, the deliverables are available, but we're going to put everything in one document so that you have immediately an idea of what is in there, what is the architecture about, and how you can get in touch with the right people in the consortium if you want to go further. Next and final slide. So we can say that we globally achieved a TRL 7 level within the project, although some components such as machine learning are still very at a very early stage. The access to a robust documentation on clinical patient well-being and socio-economic benefits are preconditions to convince health authorities and healthcare organizations to invest in vCare, aside from the usability issue, of course. And vCare now, we opened a new transition period of 3 years to comply with the remaining to do. And finally, we will be using at least those 2 following passes, direct exploitation and indirect ones, to give vCare the best possible chance. Thank you very much.